Hello, everyone. We will get started with today's webinar in just a few more seconds here. Give everybody a chance to join us. Thank you again. Hello, everyone, and thanks for joining today's Case-Worthy Impact Series webinar, The Power of Data and Building Capacity to Strengthen Operations. I'm Kelvin McCord, Director of Marketing and Communications with Case-Worthy. We're glad you could join us today, and we'll get started in just a moment. But first, a few housekeeping notes. A reminder that today's webinar is being recorded and will be available on demand in the next day or so on our website at caseworthy.com. And also, while your microphone and webcam are automatically muted during the presentation, we do encourage everyone to participate in today's webinar by posing your questions to our two speakers. You can use the questions section of the GoToWebinar control panel on your screen to ask questions, and we will pose those after today's presentation. And before we begin today's webinar, I did want to introduce you to our two presenters, starting with our guest presenter, Anita Frankhauser from Neighborly Care Network. Anita is a registered dietitian and nutrition director for Neighborly Care Network, Meals on Wheels, Pinellas County, Florida. Neighborly Care Network is a private nonprofit organization serving seniors in Pinellas County since 1966. Neighborly provides adult daycare and transportation in addition to its nutrition programs. Anita has conducted public speaking engagements at national organizations such as Meals on Wheels America and is considered an innovator by her peers. Also today with us is Greg Prosser, Vice President of Product Strategy at Case-Worthy. As Vice President of Product Strategy, Greg oversees the organization's strategic product initiatives. Greg has more than 20 years of leadership experience working with the Aging Services Network. He has worked on strategic partnerships and data analysis projects with Meals on Wheels America, Brown University, and the West Health Institute, in addition to the countless organizations that lean on his institutional knowledge and understanding of best practices for data management. Before joining Case-Worthy, Greg was CEO and President of Accessible Solutions Incorporated for more than 20 years. And so with that, I will turn it over to Greg and Anita.
Awesome, thank you, Kelvin. Yeah, I started my career doing this when I was 15, so that's how I get so long doing this. So good stuff. Thank you, Anita, too, for joining me in this. And I think one thing that's important to point out to the audience is that we're going to do a kind of interactive, conversational type of presentation for you today. Somewhat formal, somewhat informal, but we hope we have the right balance that'll make this interesting and enjoyable to participate in here today. So we're going to cover a handful of things in this session, starting with the importance of using data to inform strategic planning, business decisions, and evidence-based practices. We'll touch on a little bit about quantitative, qualitative data management on that aspect. We're also going to get into data management practices that really will help you streamline operations and promote efficiency. We're going to talk about structuring of data to ensure reliability and maximizing impact. Strategic partnerships, a big area where I think Anita will add a lot of value to in regards to partnerships and how data is being used by some of our customers. And we'll talk about some examples of data that's being used in business as well. And I'd say to kind of summarize that, we're going to talk about why data is important, and we're going to talk about how we can hopefully inspire you to take advantage of the data that you're capturing today. So what is data in human services? It really kind of boils down to vast quantities of information related to clients or members or patients that we're serving, consolidated to analyze and identify trends, provide evidence, and identify areas of improvement of the services we're providing. And in many cases, we refer to that today, data, as being gold. Anita, you want to touch on this?
Data is gold, and to all the direct service providers out there like me, you're sitting on a data gold mine. You are in the community every day. You see clients and your constituents every day, and so you have this unique opportunity to collect community level data.
Awesome, absolutely. And I thought this was a kind of an interesting quote from Edward Deming, who's a statistician. I love statistician, that word just sounds good. But in God we trust, and all others must bring data. So you can't come to the table nowadays trying to validate or prove a point or to have any evidence behind or substance behind what you're trying to communicate without bringing data to the table. So that's why it's such an important element. And we want to talk about that and dive into it. But really, before we get started too deep, we wanted to do a quick poll at this point to ask you where you're at in your data journey. So we'll go ahead and start that poll now. All right, numbers are coming in here. So you can see kind of where you're at. You have no idea. We're just getting started, halfway home, near the finish line. Looks like we've got folks leaning towards the halfway home side. About a quarter of folks just getting started.
Yeah.
We got about 75% of the folks that voted in here now. Yeah, it kind of looks like that's the trend. In essence, about just under halfway. That's interesting. Under half or halfway home, or right around half or halfway home. 26 or so percent just getting started, and about 17% near the finish line. Congratulations on that. Really, congratulations to folks that are just getting started. You're halfway home. You're near the finish line. For those of you that have no idea, hopefully we provide some value today to get you to the next step in your journey. So we'll go ahead and close that poll. So what's driving the need for data? Well, we know that rising costs are happening everywhere around us. Since the pandemic, of course, inflation has been out of control, right? And it's just something that we're all dealing with in all aspects of life, not the least of which is going to be driving health and human services or healthcare costs. We've got the silver tsunami that we're in the midst of, where the aging population is growing faster than any other demographic in the US at the moment. That's driving not only this unprecedented demand, but of course, combine that with challenges and limited funding that we have available to provide services. And it's not just an aging service audience I know we're talking about here today, but I think that does illustrate some things for us. We've got increasing competition, the not-for-profit and the for-profit organizations providing the similar or same services to those end clients, those patients, members that we're trying to serve. And that competition is just ratcheting up the requirements to provide better service and better validation of the services that we're providing. Patient outcome incentives are driving things as well. Now it's not just about delivering a service, it's about showing value to the service that you provided. And also evidence-driven decision-making is another aspect in which we'll get into. Can you believe that 18.3% of the GDP now is going towards healthcare expenses, almost 4.3 trillion. That was the latest, I think 2022 information is where I got that from. Almost $13,000 a person in the US right now is going towards healthcare expenses. So crazy stuff. So we talk about qualitative versus quantitative data, and I've got some sections on the slide that really show you some of the highlights of it. But quantitative data is really anything that can be counted or measured, and it refers to numerical data, right? Qualitative is more descriptive, referring to things that can be observed but not measured, such as the colors, emotions, and things along those lines. And I think, Anita, as we talk, the sweet spot is kind of right in the middle, right? This balance of the two where you can blend in your organizations. And I wanted to have you touch on that.
Yeah, the intersection, that's where your story is. That's where you meld service data, for, like in my example, client meals or meals delivered, with anecdotal data or stories from our volunteers that tell us about how they saved someone's life because they could call 911 for them, or how clients call us and say, because of our meals, they no longer have to choose between purchasing their medicine or buying food. So that is where the story lies, and that is what decision makers, your board, funders, that's what they're looking for.
Absolutely. Yeah, good stuff. So health and human services and big data. What is that really saying there? It's where we're providing evidence, trends, areas for improvement, or insights into our communities, shape strategic partnerships, which we'll touch on further, supports program design, and informs social determinants of health.
So speaking as a provider, I can speak to all of these things. We use data regularly to inform decisions. Having a strong grasp of managing data has allowed us to be nimble. In 2018, we had 16 funders, and now we have 24 funders in the nutrition program. Gathering insights into communities, we can collect information on what our clients want, where the needs are. It helps us determine where we're going to build our next nutrition site. Where is the need? Where are the most people on the waiting list for meals? And then it helps us participate in research studies where we're actually collecting data on social determinants of health.
Yeah, absolutely. So some of the considerations in data management practices, and I found the study, Stanford Social Innovation had done this review, and it was really talking about like the data supply chain. And ultimately, as a result of that, kind of breaking the result or the impact into a few areas. But when we talk about data supply chain, it's really like, who does our organization serve? And in essence, that's going to be the clients that we're providing service to, or the members or the patients. It's the people that you as an organization, the people that you're serving. And I like to refer to our organization as a software for people serving people, because that's what we're all about, right, on this call, or all of our organizations. In essence, at the end of the day, we're serving some of those most vulnerable folks in the population. And these folks are all part of the community, so they could be suffering from a range of disadvantages. And ultimately, there's kind of this supply chain of people that are in the front line trying to help provide services to those folks. So it could be, you know, at the beginning entry point of that, program coordinators, care managers, case managers. It could be CEOs, executives, executive directors at organizations, all the way to policymakers. But everybody on that food chain, or that food chain, or the supply chain, let's say, are all about seeking data. It's just a matter of different pieces of data that we're going to be looking for in that journey, right? And so when it comes to now the impact of this, we're really kind of breaking this study, in essence, breaking it into three core buckets. We've got like, how much did we do? Like, what did we do for the people? How much did we spend? And what kind of impact did it make? When we think about what did we do, every service, everything we do or provide to an individual client that we're serving, in essence, comes down to a transaction or an activity. And it's critical that we make sure we capture every time we provide one of those activities. And we can kind of put those activities into a couple buckets, like immediate activities and long-term activities. Immediate activities might be a scenario where you have a domestic violence instance and you need to find a safe home or shelter for that individual that might be being abused, right? So you can have an immediate impact on that individual, and you're going to take care of documenting, defining what it was you did, and a very clear, definitive outcome because of that service and transaction that you provided for that individual. A long-term activity might be educational, infrastructure-related things that just aren't immediate impact, but they're still influential in making an impact in the long term for whatever it is that you're trying to achieve in those areas, right? So ultimately, everything we're doing, we're defining and documenting those transactions or activities. We then talk and transition to, like, what did we spend to provide these services? And this is an easier area to track for us than maybe historically it may have been, because we've got better financial reporting and management systems in place today to track payroll of all the folks that are doing the activities. It might be an equipment perspective. We may have vehicles that we're using to deploy or transport people, or end cost of goods sold, like meals, right, and eat at your organization that you guys are providing. But we can now define those costs that relate to the activities that we were providing to those clients. But the challenge, of course, is the last one. What was the impact? How much did it matter? And this is where it really could, puts a lot of strain on a lot of organizations, because in many cases, this is where the supply chain in this scenario is broken. I mean, we're going to be providing, the program staff are always going to be looking for better ways to provide services to people. The donors are always going to be looking for what was the long-term social impact, right? And so that's kind of where the crossroads are. And the only way we as an organization, as partners in this journey, all of us in this call here, can do this is through the analysis of data, all right? That's going to be the bottom line. So one of the call to actions that we wanted to throw up here today, and we talked about the silver tsunami earlier, but according to ACL, Administration for Community Living, we've got an aging population projected to reach almost 81 million by 2040, almost 95 million by 2060. And again, as I mentioned earlier, older Americans, one of the fastest growing segments of our population. And to put that in perspective too, today we have about 54 million individuals, and 60 or older is how we're defining like the aging population. So 60 or older, about 54 million. So that's a significant growth, and that's the most vulnerable of vulnerable in our population. So healthcare costs are only going to exponentially grow along with that. And I know that, again, not all of us in this call related to aging services, but all of the different segments that we're serving, all the vulnerable people that we're providing services to are all being impacted by some of these changes. So we talk about opportunities now, like value-based care is one of those. And that's really a scenario or model where providers are being paid based upon the outcome. So again, kind of a changing the way that data is being managed and providing opportunity. And we think earlier we reflected on the competition. If you can differentiate your organization by being able to analyze and define the value that you're providing or the outcome that you can define that you provided to your client, that's going to segregate you from the competition and separate you and put you in a new level here. Leveraging healthcare partnerships, really any partnership, doesn't have to be healthcare related, but leveraging your partnerships. Anita, I know you guys have done some really cool stuff in this area.
Yeah, when you really hit it home when you said it really helps you to differentiate your program. Having strong data management processes and a strong, robust client database where you can collect client information securely is so important to healthcare partnerships. So locally, for example, we've worked with a local health system where we can collect food insecurity and malnutrition screening data as part of a grocery delivery initiative. And then nationally, we're part of a Medicare Advantage plan benefit where we serve meals to members in our area.
Yeah, that's good stuff. Excellent. And then finally, kind of a lot of this opportunity ties back to how do we link the things that we're capturing, the data we're storing to a social determinant of health, because that's such a hot area of obviously improving the lives of those vulnerable population we serve relates to the social determinants of health. And we've broken that down into here. Many of you on this call are probably very familiar, but economic stability, neighborhood and physical environments, education, food, community and social context, healthcare systems. And you look at those main categories and a lot of subsets that fall into those categories as well. But ultimately, I think what we're trying to accomplish here is all of this data that we're capturing, and we think about demographic information on those we serve, service-related details for those individuals that we're serving. We want to be able to categorize that and tie it back to a social determinant of health. And as you can do that type of capture of information and link it to that social determinant of health, it's going to be impactful again to your payers. And maybe talk about the nutrition aspect of what you guys do.
Yeah, for example, in our program with Meals on Wheels on our dining program, we can tie the delivery of nutrition to reducing social isolation as part of that community and social context. And then we have partners who look at that data and can draw associations with that program with healthcare outcomes and quality of care, healthcare utilization.
All right. Thank you for that. Yeah. And I think that really this kind of slide hits home a bit. Evidence-based approaches and data-based decision-making equal lower cost and better pay, right? Evidence-based approach, data-based decision-making is going to equate to lower cost and better pay. I think that's impactful. Even a few simple interventions can have an enormous impact when it's scaled up, right? We think about this across a handful of clients, a few hundred clients, a few thousand clients that we're serving. Now we're talking major impact. I want to talk about a few examples of data in business as well here, and kind of this ties back to VNA in Dallas. So I was doing a project or presentation years back, and this individual from the VNA had shared this information, said I could share it in the future if I wanted to. So I thought, hey, this is a perfect opportunity to insert this into this presentation. They were talking about measuring, and at the bottom here it says, our mission, analyze the Meals on Wheels program to determine impact, quantify return on investment, and ground donation discussions in data. And really there were like, how do we do that? And in a few different areas here, how do I quantify the real world effect of Meals on Wheels? What impact does it have on the community at large? And how do you differentiate and signal the value created by your organization? And so on the quantifying the impact, in essence, what they started to do is analyze the data through simulation models. And, let's say this hurricane, National Hurricane Center type of analysis is a little bit beyond the scale of what we're going to obviously do at all of our provider network or human service organizations here, but I still think it's very valuable. Certainly, this hits home, I know, to Anita and I, because we both live in Florida, and she's on the West Coast, I'm on the East Coast, but when it comes to hurricanes, the hair raises on the back of our neck a little bit. But in essence, we're talking about developing simulation models, running, tracking data and running it through lots of hundreds of thousands even of simulations to determine what the outcome could be or may be. And based upon that, you can kind of test the hypothesis and run optimizations, finding your best alternatives. But the concept that we're talking about with that is kind of what they were trying to do in regards to monitoring meals. And the monitoring of the VNA's clientele says their team was able to model the impact of the Meals on Wheels program through a combination of different data sets, some of it being VNA related, some of it being public information that was accessible, and some of it based upon research they were doing. And you look at this little graphic here, and we talk about like diet composition research and disease modeling, and some of the information like health state collaboration are capturing in regards to disease and localizations within the state of things happening and what the costs of services are impacting hospital network and service providers. So kind of looking at those different data points ultimately allowed them to see where they fell in regards to impact that they made. And you kind of look at this chart, it looks like a reduction of healthcare costs around 7% in the city of Dallas, based upon those clients they were serving nutritious home delivered meals to. And at the bottom, in essence, saying the Meals on Wheels program is estimated to prevent 24 heart attacks, 12 congestive heart failure hospitalizations, and 12 strokes a year. So again, I just thought this was relevant, and I thought impactful to the topic that we're going through here. So where does this leave us in regards to where you can start? And we're going to break this into two buckets, a macro and a micro perspective. I'll take the macro, and Anita, you're going to hit the micro. But we start with strategic plans, defining what it is that we want to achieve, right? Start with information, like try not to overcomplicate this too. You've got data you're already collecting. How can we leverage this data, right? Make sure you've got defined goals that make sense, that show impact, that are relevant to your organization and to the clients that you're serving, the vulnerable population that you serve. Think about what you need to collect versus the nice to have. A lot of times over the course of years working in the human service space, I see all these different assessment tools sometimes that we have that tracking hundreds of data points, and sometimes those data points are just not all relevant to the outcome that we're trying to focus on. So making sure we have the right points, and also leverage partnerships where you have this opportunity to do so. There are different strategies on some of this. The one that I kind of like on the bottom here, the SMART, we got the clear methodology, but the SMART, specific, measurable, achievable, relevant, and time-bound, I think really hits home. So Anita, I wanted you to touch on that too.
Yeah, most of you out there mentioned that you're halfway home or just getting started, and I have to say I'm in the journey too. I'm still working through our data management goals and policies and procedures. But these are just some key takeaways that I wanted to share with all of you that I've learned in that journey. First and foremost, it's really important that you identify key people to know and own the data, from people who are entering the data to collecting the data. It's really important that they know and they own it. And then with that training, you can't do too much training. I think just looking at our experience with volunteers collecting information, we do have to continually remind people about how we're collecting data and the importance of it. But having a consistent message about the importance really helps with training. Scheduling data analysis time points. So I make a point to have regular time points in my calendar where I'm going to be looking at the data and what is it saying, whether it's weekly, monthly, quarterly, annually. It's really important to get in the habit of looking at it regularly. And then when of the data you're collecting, making sure that you represent it consistently so you can ensure that you're comparing apples to apples.
Excellent. All right. So let's transition into data structuring and reporting side of things. One of the biggest challenges that we inevitably run into when we're getting into a project, we're sharing data across multiple organizations or rolling data up to maybe a state organization or some other regional organization, I should say, that you need to put maybe whether that payer or whomever is building data standards, because we track the same data in so many different ways, unfortunately. And that makes it really difficult, whether it's, I've got a few examples here, health conditions, fall risks, food security, just a simple scenario at the bottom here, talking about health conditions. We've got congestive heart failure defined 4 different ways. I realize I have one of those ways listed twice, but nonetheless, multiple ways to track the same thing. As we're trying to share this information with other organizations, we either have to have some methodology to map that out to connect these data points together that they mean the same thing, or if there's opportunities to track data in a similar, if not the same way, it makes a huge impact in this process or this journey. So I think when you've got partners together working for a common goal, trying to strategize and get like what are the core data points that we're trying to summarize at the end of this process. Let's come up with some consistent data tracking capabilities that just make it so much easier to aggregate and report information if we do that based upon what it is that you're trying to capture.
Yeah, having strong data standards is so essential. It saves time on reporting and saves your sanity. I laugh whenever I see this, but in our previous system, municipality or city names, and we have 24 in Pinellas County, but the municipality names could have been entered in all of these different ways, and it all means just one city, St. Petersburg. But as you can see, it can create a data nightmare when you're trying to report on how many clients are being served in a certain area. So also similar errors like this in a client's name. For those of you who do electronic billing, errors in client names can cause delays and inconsistent billing. So it's really important to have strong data standards.
Absolutely. So what are some of the challenges that we're considering here in this scenario? We've got a lot of organizations with fragmented technologies, meaning we've got multiple systems for different services or different components of our operation or organization where we're trying to capture data, right? Not one centralized system. Sometimes we've got spreadsheets that we're still using, and I cringe in the scenarios today when I find out a customer of ours is using a spreadsheet to capture data that I know can be captured and centralized in our database. Paper-based reporting capabilities or elements that still fall into many organizations where we're not pulling data directly out of our systems that are available to us. Bad data. I mean, this is something we run into so often where we've had historically heard the, garbage in, garbage out kind of scenario, and that's still something we work with a lot. So talking about those data standards in the prior slide too, de-identifying data, we're sharing data amongst organizations, and sometimes we've got PHI, PII, and we've got to make sure that we're, sharing that data in a safe, secure way, right? Interoperability and integration. Interoperability is something we're going to talk about a couple slides from now, but that's kind of where we need to get to, right? Having the ability to share data and having an interoperable capability of doing so from the service provider up to the highest level in the hierarchy, wherever that may be. And that's super critical. And then again, finally, the security compliance, talked a little bit about that on the de-identifying of the data, but security in this landscape can't be emphasized enough. So some organizations think, if I just keep this on my local server, maybe manage this data in a spreadsheet, it's so much safer than putting this out on the cloud into a network where it can be accessed or hacked easily. And I'd say in most cases, that's not the case. Most of the infrastructures that are put in place, whether you're, like in our instance, we're hosting all your data in Microsoft Azure. We've got authentication elements that are making sure that nobody can access that data without getting authenticated, and lots of security measures ultimately being put in place. But that's a critical element of that. Right, Nina?
Yeah, like I said earlier, a lot of these challenges are still my challenges. We're still using spreadsheets, and it's still our goal to eliminate the use of spreadsheets completely and only use our client database, but it's definitely something that's on our goals. But I can also speak to paper-based reporting. So before we started using ServTracker and Mobile Meals, for those Meals on Wheels providers out there, you'll know what I mean. If you have to print your route sheets only once, this is assuming that you're only printing them once. We were processing over 100,000 pieces of paper a year. That's printing all the route sheets for everyone around the county, collecting them from the various sites, bringing them to our admin office, and then someone was actually keying in all of that meal information notes on the route sheet. So when we transitioned to the Mobile Meals app and we got rid of our paper route sheets, we saved all that time, and I actually had to restructure my department. I took all of the people who were doing data entry and I made them into coordinators who are spending most of their time talking with clients, addressing what their needs are, making referrals for them to other services in the community. And so that's really where I want our staff to spend the most time, is with clients and not doing any data entry. And I'm really happy to say that because of our data management, we're able to get rid of over 20 5-foot tall gray filing cabinets, because we're also working on a paperless client file. So again, it has really helped us to streamline our operations and our personnel.
That's awesome. So the bottom line here is we want to make sure that technology is working for you, right? Obviously not against you, but to really help you collect, integrate, analyze, and apply your data. And that really feeds into like what we're doing as an organization as a whole at Caseworthy. And you may not have seen this and know the depth of kind of our strategy and thesis, but in essence, we're looking at providing whole person care. And you look at this wheel, this kind of circle of life, I like to refer to it. On the left-hand side, you see Caseworthy, this case management enterprise solution. And to the Caseworthy family, we've added in the ServTracker application, which has been in the industry for 20 plus years, focusing on the aging services space. A lot of direct service providers, Anita's organization utilizes it, and now bringing into the fold as well Metasced and a couple different applications that they have, Connect, Coordinate, and this Exchange application that really is for the care coordination aspect of our industry, and as well as intellectual developmental disability and behavioral health. So it's bringing together a suite of solutions designed to provide whole person care to the health and human services market. And the nice thing about this too is that what we're able to do, because it's one suite of solutions under one umbrella with the Caseworthy family, the interoperability is something we have total control of. And we have the ability to make sure data is seamlessly communicating from one product to another. And it's just something that you don't get when you've got different organizations publishing public APIs and trying to share data. And you can do an okay job, but you can't get true interoperable, two-way communication in essence of data shared between your systems. And in essence, we've got a strategy and an ownership to bring whole person care and solution interoperability to the human services market. So that's what we're here to do for all of you on this call. And again, now to summarize what we've talked about, and we're trying to put a lot of information in about 35 minutes here. It's all about the data, right? Data is powerful. It is the new gold. Technology partnerships are absolutely critical and can really help you through this journey. And data is critical to articulating impact, just like we talked about, like Deming said before, in God we trust, but if you don't have data, it doesn't mean anything else. Data collection strategies, how do you get started, and things to consider. So we're hoping we provided you some information during this session here. We want to really now give you an opportunity to ask some more questions. And I'll kind of pass it over to Kelvin and see what we might have queued up for us here.
Sounds good. Thank you, Greg. Thank you, Anita. Very insightful and we hope beneficial presentation for all. Again, a reminder, if you'd like to pose a question, feel free to do that in the questions section, but we do have a few to share in the remaining time we have left. I'll just pose this to both of you. You kind of volley between the two of you as you need to, but Greg and Anita, a question is, what is the most impactful data to collect to advocate for your program? And really, part two of that is, how do you best measure that impact?
Yeah, I'll start, Anita, if you want, and then think about that. I mean, when I think about the most impactful data, I mean, it starts with the person you're serving, right? The demographic even information of the individual you're serving. And that demographic information can not only touch on, where they live, but their age, their income, what, vulnerabilities they may have as an individual. And then you're starting to, based upon that person's status and individual information, you start to capture and track, again, all these interactions. We touched on it briefly earlier about like activities. Every time you're interacting with that individual, defining and documenting what those are, and then ultimately the relates to the service too, right, that you're providing. The net result is I'm providing some sort of service to this individual and I'm logging this. So now I've got information about the person. I've got all these interactions I've had, and I've defined these services that I'm providing. And as a net result of that, hopefully you start to see some of the vulnerabilities that the individual have improve. Anita, I don't know if you want to add something to that.
Yeah, and this is why I like the Mobile Meals app. It helps us to collect client data in real time so that we can act on it. And then all of that, all the comments from the drivers go right into the client database. So, and we can export that information and look for trends. How many times have we had to notify the family about this client, and over the year, how often are we notifying the caregivers or families about the status of a client? So it's all really, really important information to have, and then put together to, like I said earlier, to tell that story about what you're doing for the clients aside from just that your direct service to them.
I want to add one thing too, just for the audience as a whole. Anita's mentioned a couple times Mobile Meals app. She's mentioned ServTracker. That slide I had earlier that talked about Caseworthy and this whole person care. We've got Caseworthy, ServTracker, and the Metasched solutions. One of the tools that are Anita's organization is currently utilizing ServTracker to manage all the clients she's serving, the services she's providing. And nutrition is one of those services, and one of the features we have in the ServTracker application is a mobile app that allows you to monitor where your drivers are at, what meals have been delivered, real-time communication on the road with those folks delivering meals. So I just wanted to add that context to make sure we're clear on that. Kelvin?
Fantastic. Thank you both. Another question to the two of you. Where do you see technology trending that may impact how data is managed?
Yeah, I'll start again with that. I mean, a big one to me is one of the last slides we had up there, which really touched on interoperability. I mean, I think one of the biggest challenges that is out there for many of the organizations today. I mean, in fact, I was talking to somebody in state of Florida here a couple months back, and they have two divisions in the state where aging services, matter of fact, and developmental disabilities. And those two organizations, two state agencies, are both capturing data on the same people they're serving, but that each side doesn't know that the other's serving that client. They have no interaction between the systems. Matter of fact, in this case, the systems are even being managed by the same organization, and they have no way to share the data. So interoperability is the big issue, and that's where absolutely what we're trying to solve in this scenario. What we are solving is that from our perspective, because we can control that. In that same exact scenario, you could have a case-worthy suite of solutions completely communicating, and so the left hand knows what the right hand's doing, and that's a big one for me. And the other is consolidation of this fragmented technology market, and I think there's an effort again to provide this whole person care through a suite of solutions that allow us to address some of the fragmentation that we're having right now. So that's my 2 cents.
Okay, great. Well, Greg, this might be for you specifically. What is Caseworthy doing to support the adoption of developing data standards? For instance, Microsoft's Common Data Model and Common Data Service for nonprofits.
Yeah, so I think that from our perspective, we've got a roadmap that's exciting and aggressive. A lot of things that we're trying to do to bring to the market to standardize the platform integration with Microsoft tools, for example, is a big part of that. Part of that, even with the journey that we're going transitioning to migrate to Microsoft Azure for our hosting services, but managing, I think, and aggregating information kind of centrally, giving the customer the tools, the flexibility from a configuration perspective that have kind of make the system as nimble as we can. There's a lot of things that we're doing in the application right now, from a form designer and a query designer features, query app builder and form app builder, to allow flexibility and for the end users to adapt and accommodate changes to their program's needs. And the other piece of it, again, it kind of feeds into this interoperability component and allowing the application to integrate with other either third-party tools and or our own internal tools more easily. So that's a big part of where we're going.
Wonderful, thank you, Greg. I think this might be a final question just to end today. And I know that you've all touched on this a little bit, but maybe it's a great place to just sort of summarize. But what can organizations do to start their journey towards impact with the help of data?
Yeah, Anita, you want to start on that one?
Yeah, as I talked about earlier, having a plan, having a strategic plan about what data you're going to collect, how you're going to collect it, and having key people who know how they're going to collect the data and how we're going to use the data. I think just having a cohesive plan and buy-in from leadership is so important to get started.
Yeah, absolutely. Yeah, I mean, probably the number one element is having a plan, right? And again, the communication of that amongst your team. I think once you have the plan, once you have the support, finding the capability of managing the data, certainly in partnership with the Caseworthy team, we can absolutely help you on that journey as well. But I think, the tools are available to you. You're just making a decision to move forward and gathering the team to be in sync and harmony with that. It's going to be your number one benefit or bonus right now. So.
Well, great. Thank you again, Anita and Greg. Reminder for everyone that joined us today, a recording of today's webinar will be available on demand in the next day or so on the Caseworthy website at caseworthy.com. And please be sure to check back with us, visit our website for more information on future webinars as part of our Caseworthy Impact series. And thank you again to both of our presenters, and thanks again to everyone for joining us today.
Thanks, everybody.
Thank you.